Okay, Dr. Sayago, thank you so much for agreeing to do this brief interview with us. If you could just give an introduction on where you are with your practice.
Yes, I'm Mercedes Sayago, and I finished my residency in 2009 at the University of Tennessee in Memphis, and then relocated here to Southern California. And this practice I've recently opened in July of last year, so it's we're still a little bit under a year with the practice. Growing slowly but steadily.
Good. So tell me, how did you learn about the conference, first of all?
Well, I have a very good friend of mine who practices in Modesto, and she had called to let me know if I was attending this conference because she was going to it, and I really didn't know about it. So since she knew I was interested in e-sure and then myosure and then office hysteroscopy, just because of our training, she went ahead and registered me, and then I went.
Sounds good. And what were your goals and objectives going into the class?
Initially, my objective really was to just get more up to date with e-sure, since I really hadn't done any in-office procedures since residency. So I wanted to get more familiar. I had a couple cases lined up in the office, and then just to kind of see what was available and what the new updates were, and if there was anything new that I could learn. When I got to the conference, I was really pleasantly surprised because my focus has always been more medicine. I'm not business oriented and never have been, and it never really has been my intention to be a business owner. But when I got there, the physicians that were at the presentation were extremely they were able to convey what they were doing in their practices, but it was very business oriented, which at first I was a little taken aback just because of my background, but then I realized what they were doing was really providing us a better tool to take care of our patients, but then also to help us in the business aspect, in particular with me being a solo practice, which is really important and which I really hadn't grasped up to that point. And so it really turned my thinking around to, yeah, I am a business and I really need to focus on the business as well as the practice development clinically, in order, one, to provide better care for my patients, but also to make my practice more successful, so I can also provide that care, but then also take care of myself as a business owner. I thought it was a really good program. The speakers, all of them that they had, were excellent. They really provided new little tidbits, different things to do, the procedures that I was already familiar with, but different approaches, little hints here and there, and then also bringing in the business aspect, which for me has really opened up a whole new world as far as how I can develop my practice.
So it was kind of a mixture of not only the hologic people, but also maybe more that peer-to-peer.
It was really a lot of it was, well, one, learning the different things that were out for. I wasn't really familiar with the hologic THS system, and then but then also it was really the peer-to-peer interaction that I had with the professionals that were there speaking. I just thought it was just crucial. It just really, for me, has been probably the best conference that I've been to recently, or at all, since I've been in private practice, because it provided clinical information, but then it also provided the business information that I feel that I really needed and is crucial for me in developing my practice, and then trying to also bring in innovative procedures and techniques into the practice, and then being able to provide that for my patients.
Gotcha. So I guess that the biggest takeaway was really maybe the business aspect of it, because you were familiar with e-sure and you had done NovaSure
Right.
In your residency, but it's really just the aha moment on how am I going to transition this into my practice.
Exactly. So so when my residency program was really big in office procedure, thankfully, which was really nice. So I came out with that knowledge and that wanting to do office procedure and provide it for my patients. But what I hadn't had was the big disconnect that we have from residency to when you go into private practice, that you really don't have a business orientation. And this, for me, brought that business aspect into the in-office procedure and then in my practice. I thought it was excellent. So I think now I feel that I'm better prepared and can have a more rounded practice, just really because of this one conference.
Sure.
Yeah.
Sure. So, in your opinion, are there any improvements that you think that we could make as a company when we roll these types of training out to others in the field. Is there anything that you walked away and thought, they could have done a little bit better here or a little bit better there? Anything in particular you can think of?
No, I really think it was a really good conference. The speakers that were there were excellent. I thought where it was really nice. Maybe for me, since I wasn't aware that it was there, it would have been nicer just to have just maybe more local awareness. I don't know what population they were targeting to attend this conference. Fortunately, my friend in Modesto knew about it, but I really thought it was excellent.
Did you think that being during the week was that a negative, or
No.
a weekend would have been a better format for you? Or?
Because I'm a new practice, I'm a little bit more flexible. What I did notice, but there were plenty of physicians, so the middle of the week really didn't impact me as much. I think sometimes, maybe the weekend, I actually think might be sometimes a little bit more difficult.
Okay.
Yeah, just because
Family obligations and that kind of
things
stuff.
like that. But
Okay.
yeah.
Okay. So if there was any one kind of core message that you'd like to drive back to Hologic, knowing that this is it's a pretty substantial expense for the company, but if there's a way to drive something back to our company to let them know how it's really changed your business, is there anything that you can think of or would like to say and drive back to our company?
I think as far as for, regarding Hologic as a company, I think it's the programs is very important and it's crucial. One, to get your systems out, and then because they do provide, they help us provide better care for our patients, and then also the way you incorporate the business aspect and showing us how to incorporate it in our practice successfully and to get it out there for our patients, I think is the most crucial thing. That was really important. That's really the main message that I got out there. We have these systems. Yes, you know how to use them, but this is how you can actually apply them to your practice and not only be gainful for you, but gainful for your patients as well.
Great. Thank you, Doctor. I really appreciate your time.
You're welcome. Thanks.